Okay, so I'm going to be teaching you guys how to take a blood pressure for this class period. And when you're taking a blood pressure, one of the first things that you want to do is you want to have your patient put their whole arm, palm side up, on the table. We like to have it, if possible, like heart level, but it's not mandatory. Make sure that the patient is not crossing their legs, because that can affect your blood pressure. Now, the next thing I'm going to do is I'm going to find her brachial artery. So I'm going to feel for a brachial pulse on the pinky side of the bend of her arm, or the antecubital, okay? So I'm going to feel on this side. Okay, and I can feel the pulse of the brachial artery right in here. So that tells me, A, where to put the arrows of this blood pressure cuff, and B, it tells me where to put my stethoscope to listen for the blood pressure. So the arrows on here, one says left arm, one says right arm. So since this is her left arm, I'm going to put this arrow above where I felt the brachial pulse. Now I want to put the cuff about 1 inch above the antecubital area. So I'm gonna put this up as far as I can. Put the arrow above where I felt the pulse. And I'm gonna put this real snug around her arm. Next, can't get this off now. I'm gonna clean my stethoscope using alcohol. So I'm gonna go ahead and clean the stethoscope and the earpieces. Now, while that is drying, I want to get any air, make sure there's no air left in this cuff. And then I'm going to turn the knob. And depending on what blood pressure cuff you get, sometimes you turn them clockwise. For most of the regular looking blood pressure cuffs, these particular ones, you have to turn counterclockwise to be able to inflate the cuff. When you get to the point that you can't turn this anymore, go ahead and stop, because you do not want to get this too tight, or it's really hard to unscrew it once you're trying to let the air out, okay? So I've got that ready. I'm going to put my stethoscope on the brachial pulse. Now I will not hear anything at first. I will not hear anything until after I have pumped it up and it's coming back down. And for blood pressures, we are looking to see what number the needle is on with the first sound you hear, and where that needle is at with the last sound that you hear. Okay, so I like to use 2 fingers to stabilize the stethoscope, because any movement can cause sound, and you might mistake that for a blood pressure beat. Okay, so I'm gonna put that over the brachial. I'm gonna get to pump this up, and I'm gonna go above 160, and then I want to very slowly and evenly let the needle go down, and I'm just going to listen. Now, on her, I heard the first beat at 102, and then the beats got a little bit louder and louder and louder. Then they go back down in volume. And the last one I heard was over 64. So then I'm going to chart my blood pressure in a fraction form with the numerator being 102 over 64, which is your denominator. The numerator is that systolic blood pressure, and the denominator is the diastolic blood pressure, okay? The systolic, the pressure when the heart is beating. Diastolic, the pressure when it's not beating, it's resting, okay? So, all right, any questions?